All right, do me a favor. Take a big breath in. Now let it all out. See that? You just used one of the most incredible and honestly most overlooked systems in your entire body. So today, we're going to take a journey inside that amazing breathing machine, your lungs.
So, let me ask you something. Have you ever really stopped to think about all the work your body has to do just for you to take one single breath? Because, it's not just one breath. It's, get this, more than 20,000 breaths every single day. I mean, that is just wild. It's this nonstop 24/7 job that your body does without you even having to think about it. So let's dive in and really see how this incredible machine works. Okay, so here's our game plan. First, we'll check out the upper airway. Think of it as the gatekeeper. Then, we'll journey deeper into the lungs themselves. We're also going to look at what happens when things go wrong, how doctors figure it out, and finally, how we can get that healthy breath back on track. All right, first stop on our tour, the upper airway. Seriously, you can think of this whole area as your body's own built-in, super sophisticated air filter and conditioner. This whole system is like a perfectly coordinated team. It all kicks off with your nose, which does three crucial things. It filters, warms, and moistens the air. From there, you've got the paranasal sinuses. They're what give your voice its unique sound, kind of like a resonating chamber. Then the air flows down through the pharynx or throat, right past your larynx, the voice box, on its way down to the main event. It's an absolutely seamless process. But what happens when that gatekeeper gets, irritated? We've all been there, right? The stuffy, runny nose. But what's actually causing it really matters. So you've got allergic rhinitis, that's hay fever, where your body's reacting to stuff like pollen. That's why antihistamines are the go-to. Then you've got viral rhinitis, the good old common cold. That's a virus, so the best you can do is rest up and drink plenty of fluids. See? Knowing the enemy makes all the difference. Okay, so the air has been prepped. It's filtered, it's warmed, it's ready to go. Now, we follow it deeper into the body, to the gas exchange headquarters. We're talking about the lungs. So from the voice box, that air travels down the trachea, that's your windpipe. And this main pipe then splits off, branching into smaller and smaller airways called the bronchi, and then the bronchioles. Think of it like a tree, with branches getting tinier and tinier as they reach deep into the lung tissue. And at the very end of these tiny, tiny branches, this is where the magic happens. We're talking about hundreds of millions of teeny tiny air sacs called alveoli. This is the finish line for that breath you took. A critical handoff takes place here. Fresh oxygen jumps into your bloodstream and waste carbon dioxide gets passed out. It's all done through a simple process called diffusion, and it happens without fail every single time you breathe. Okay, so that's the ideal scenario. But what happens when this amazing system down in the lungs starts to falter? Let's get into some of the common problems, like obstructions and infections.
A big one you've probably heard of is COPD, chronic obstructive pulmonary disease. It's really an umbrella term for lung diseases that get worse over time. The main issue is that it gets harder and harder to breathe out. It's like trying to blow air out through a pinched straw, and unfortunately, it's not something that's fully reversible.
Now, COPD typically shows up in two main forms, and they're pretty different. First, there's chronic bronchitis. Its nickname is the blue bloater, and that's because it's all about inflammation and too much mucus, which leads to this chronic cough. This can cause poor oxygen levels, giving the skin a bluish tint. Then you have emphysema, known as the pink puffer. Here, the problem is actual damage to those little air sacs, the alveoli. This causes severe shortness of breath. Those nicknames are pretty vivid, right? They really paint a picture of what's happening.
Okay, now let's talk about bronchial asthma. The absolute key difference to remember between this and COPD is that with asthma, the airway narrowing is usually reversible. The problem starts with chronic inflammation. This makes the airways supersensitive or hyper-responsive. So when they encounter a trigger, like dust or exercise, they clamp down. And that's what causes that wheezing and shortness of breath we associate with an asthma attack.
So how do you manage asthma? Well, it's a two-part strategy. You have your quick relief or rescue inhalers. These are for when you're having symptoms right now. They work fast to open up the airways. But then you have your long-acting or controller meds. These are the ones you take every day to tackle the underlying inflammation and prevent the attacks from happening in the first place. One is for the moment, the other's for the long haul.
So, when things go wrong, how did doctors even figure out what's happening deep inside your lungs? Let's pull back the curtain on the diagnostic process.
Well, doctors have a whole toolkit to play detective. They can start with a chest x-ray to get a basic picture of what the lungs look like. If they suspect an infection, a sputum culture can pinpoint the exact bug. For a really close look, they can use a bronchoscopy, which is basically sending a tiny camera down into the airways. And if there's fluid built up where it shouldn't be, a thoracentesis can drain it and test it.
Sometimes the issue is much more sudden and dramatic. A pneumothorax, that's the medical term for a collapsed lung. Basically, air leaks into the space between your lung and your chest wall. And that pressure from the outside crushes the lung, making it deflate, just like a balloon popping.
And this can happen for a few different reasons. You can have a spontaneous one, which can happen out of the blue if a little air blister on the lung ruptures. A traumatic one is caused by an injury, like a wound to the chest. This can create what's called a sucking chest wound, which sounds exactly as bad as it is. But the most dangerous type is a tension pneumothorax. That's when air gets in but can't get out. The pressure builds and builds and can actually start pushing your heart and other organs out of the way. It's a true medical emergency.
All right, so after all that, let's talk about the most hopeful part, getting that breath back. We're going to look at treatments and, importantly, how people can become active partners in their own care. Here's a simple but really powerful technique that can help anyone regain control of their breathing. It's called pursed lip breathing. All you do is breathe in slowly through your nose and then breathe out very slowly through lips that are pursed, almost like you're about to whistle. The whole point is to make your exhale last longer. This helps clear out trapped air from your lungs, and it's a game changer for people with conditions like COPD.
Now, using an inhaler might seem straightforward, but getting the technique right is everything. You've got to shake it well first, then as you press the button, you take a slow, deep breath in. And here's the part people often forget. You have to hold your breath for a few seconds. That gives the medicine time to actually get down into your airways and do its job. And another pro tip, always rinse your mouth out afterward to prevent side effects.
You know, when you boil it all down, all of these treatments, all of these techniques, they're all working toward one goal. And this quote says it perfectly. The real aim is to reduce symptoms, yes, but more importantly, to improve quality of life and let people participate fully in their day-to-day activities. It's a fantastic reminder that it's not just about breathing, it's about living.
So let's do a quick recap of our journey, shall we? We learned your respiratory system is working 24/7 to filter your air and deliver oxygen. We saw that upper airway stuff, like colds and allergies, are annoying but manageable. The bigger issues, like COPD and asthma, happen deeper in the lungs and involve inflammation and obstruction. We saw the cool tools doctors use to diagnose these problems, and finally, we talked about how treatments, from medicines to breathing techniques, can help people manage their condition and live fuller lives.
So we started by talking about those 20,000 breaths you take every day. We've seen how this absolutely incredible system works tirelessly to protect you with every single one of them. So I'll just leave you with this final thought. What's one thing you can do today to help protect it in return?